Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
For the past 10 years, Mayo Clinic's Center for Innovation, or CFI, has been focused on finding new ways to impact, to change, to make better the future of healthcare. CFI's motto is think big, start small, and move fast.
I like
That's pretty
it.
good. Techniques like prototyping, sketching, and brainstorming are used to try and find creative solutions to healthcare problems.
Each year, new ideas are shared at the annual CFI conference known as Transform. This year's Transform conference will take place in a few weeks, September 27th through the 29th in Rochester, Minnesota. And here to discuss Transform and the Center for Innovation is Dr. Douglas Wood. Dr. Wood is a cardiologist at Mayo Clinic and the medical director for the Center for Innovation. Welcome to the program, Dr. Wood.
Thanks very much.
Dr. Wood, nice to have you. So it sounds like you're trying to change things, hopefully for the better.
Change the world, change healthcare, change the experience of health for people for the better.
And why, what was the impetus to start the CFI, the Center for Innovation?
It grew out of a project that started in the Department of Medicine. The Mayo Clinic leaders more than 10 years ago recognized that this was really the future for Mayo. And then the Center for Innovation was born.
And who works there? You, obviously, but
I'm a bit player by all means. The people who really make this go are a group of remarkable people, our designers, our project managers, our graphic artists, our IT specialists, and more important, the people we work with, the patients and the people that we follow every day to discover where there are solutions for health and healthcare.
I remember the first time that I went, I just sat there with my mouth open for most of the time. I just couldn't believe all the different fantastic conversations going on. But give us an example.
Well, you
of
were
some.
there.
I've gone.
It's a place.
I have gone to this before, yes. So give us an example of some of the out-of-the-box kind of thinking that goes on.
Well, from the Center for Innovation work, we have created the program in healthy living at Mayo. We've created the Center for Connected Care. We have started thinking about how we take care of people in communities where they live. We've opened the Well Living Laboratory, which is a remarkable partnership between Delos Living and Mayo Clinic, where we actually look at how people live and how they work. So we have a simulated apartment and a simulated office space. We've actually had Mayo Clinic employees as some of our test subjects and partners in creation.
So where do your ideas in general come from? All over?
We get ideas from all over. Much of what we get is what we discover by simply watching people and finding out where they're having trouble. But every year we also sponsor a competition of sorts or an idea-generating program called CODE. It stands for Connect, Design, and Enable, and we open it to the entire Mayo Clinic. People from the entire organization can send us just a one-page summary of an idea they would like us to explore. And we get some remarkable ideas that way. Physicians come to us, nurses come to us, pharmacists come to us with ideas as well. So in our 10 years, we've worked on more than 600 projects and done more than 10,000 hours of direct patient observation.
What are some of the presentations you're looking forward to this year?
Well, this year we've got a really remarkable group of people coming. The moderator of Transform this year is Dr. Elizabeth Rosenthal, an award-winning journalist who wrote a series called Paying Till It Hurts for the New York Times over 2 years. And she's going to lead us through a remarkable group of people, including patients, including leaders from the business world and business schools and other physicians. So Clay Christensen will be participating. Dr. John Rico Ferrugia from Mayo Clinic, Florida, will be here on the last day to talk to us about innovation. Andy Slavitt, a former administrator of the Center for Medicare and Medicaid Services, a Minnesotan who actually went out to Washington to help save healthcare.gov, will give us his unique perspective. So we've got lots.
Can anyone come to Transform, or do you have to be a Mayo Clinic employee?
Anyone can come to Transform. We have patients, we have doctors, we have nurses, we have inventors, we have entrepreneurs, we have insurers, we have legislators, we have lots of people. So anybody can come. We welcome everybody.
And what are the hot topics this year?
Our goal this year is to try to find a way to close the gap between people and health. So,
and
you're going to be able to do that in 2 days.
From a financial standpoint?
In 2 days. Well, the financial point would be part of it, but at first it starts with actually understanding what we really want for people is health. With everything falling apart in Washington over the last 2 months,
Sure.
I'm looking at this as a great opportunity to say this is what we, that is people in the country, really need. And once we know what we need, we can then easily figure out a way to create those solutions and then finance them.
You know, one of the problems that I suspect that you may be faced with, you started the Healthy Dan program, the Healthy Living Center, is that correct?
Correct.
What about the problem, have you tried to address the problem of obesity in this country?
We've actually taken on obesity and a number of other problems in Transform. For example, a couple of years ago, we evaluated gun violence as a public health problem. And many of these conundrums that we face in healthcare can be approached from different perspectives, and that's one of the very core principles of Transform. Get people together who think about things in a very different way. Give the attendees a chance to see that there are different ways to look at problems, and with that, often a solution that might not have been visible. We often like to say that we can make the invisible visible.
Now, you talked about some of the projects that you've been working on. What is on your plate right now that you would say is the most exciting thing, and the most exciting potential innovation to come in the next few months or weeks?
At the moment, we're actually doing some interesting work with using voice to command computers and voice to help people interact with computers. So most everyone in the country knows about Alexa or Siri. Mm-hmm. And there are ways that you can have these assistants help you as a patient or as a physician have a more effective interaction with a device that could make your work better. So those are pretty exciting from my perspective. For example, if I said to patient home after surgery and they've forgotten exactly how to do a dressing, Alexa, show me how to change my dressing.
Really?
And it's there.
How did you get from being a cardiologist to being interested in innovation?
Actually, it goes back a long way, but the fun part about this job is you don't have to be really a cardiologist by training. Anybody can innovate if they can just get out of old ways of thinking and
be curious.
Thinking about there's always something that could be different or better.
And what about wearables? I mean, aren't we getting to the point where in the not too distant future, you will be able to wear something that will check your heart rate and your blood pressure and your blood sugar? Is that
it's here? And already there are devices that are implantable. So many devices that we put in from a cardiology perspective give us lots of data. There are contact lenses that will measure your blood sugar.
Really?
Yes. There are thin little strips you can put on your skin that will analyze blood tests like sodium and potassium that we would normally draw a blood specimen for and send to the laboratory. In the future, you'll just wear those. In our well living laboratory, we're actually using sensors to evaluate how people sleep and how they move in an environment, whether we change the temperature, for example, or the wavelength of the light. We may even be able to put people to sleep without medicines in the future.
Wow, it sounds like there's going to be a big revolution, technical revolution in healthcare in the next decade or two.
Well, it needs to be technical and it needs to be personal. So whatever the technology is, it has to fit and interact with humans. Otherwise, it's not going to make a difference.
Wow. Well, congratulations on all you've done and all you're doing, and best of luck to you and everybody who works at the Center for Innovation, Mayo Clinic. You, Dr. Wood, are the director of the Center for Innovation. Dr. Douglas Wood, thanks for being with us.
Thanks, Tom and Tracy. It was a great opportunity to chat with you.